Hi everybody, Dr. Michelle here, and what I'm going to talk to you today is about that dreaded sciatic pain. A lot of people know this pain to be the pain that starts kind of around your low back or your glutes and shoots down the back of your leg. And what I'm going to talk about is ways that we can help to release that with some exercises. Now, I do want to say I always recommend getting your spine checked by a chiropractor, because a lot of times we can figure out whether this sciatic pain is coming from a pelvis imbalance, the bones, or whether it's coming more from the nervous system and the discs, or where it's coming from the musculature. And a lot of times it's a combination of things that are contributing to it, and we can help to assess that for you and give you recommendations to allow your body to heal the best way possible. So what I'm going to talk to you today about is more of the muscular aspect of things. Now, these muscles go and attach to the pelvis or to the bones, so we want to make sure the bones are nice and aligned well and moving well so that the musculature can be in the most optimal position. Once we have that established, then we're going to work with calming down that musculature. Now, what I have here today is a little ball. It's called the yoga tune-up ball. You can use this. It has a little bit of a give, so it's a bit comfortable, a bit more comfortable than, say, like a lacrosse ball or a tennis ball, but those are also good options for you. And what we're going to do is we're going to roll this along the muscle where there's some trigger points or some areas that are causing you some grief to try to release them. Because there's this muscle in our backside called the piriformis. And what that is the sciatic nerve actually travels through that piriformis muscle down the back of your leg. And if that muscle is tight, it's going to clench and put pressure on that nerve, and then that nerve's going to signal pain to you. So what we need to do is, again, once the pelvis is aligned and we don't have any imbalances in there, we need to make sure that muscle is going to relax. Now, what I'll show you is ways that you can do that with this ball. So the ball is going to be actually put onto that muscle to try to release some trigger points and release the muscle fibers so that the nerve can then flow more freely through that muscle. So I'll show you a few ways that we can do that. So, as you can tell, I'm quite pregnant right now. This is actually a very safe exercise for pregnant women to do. Pregnant women tend to have a lot of sciatic issues because of the extra pressure going on in their low back and pelvis, but this can be used for anyone who has these type of symptoms. So we're going to put you into this position. You're going to take the ball, putting it underneath where that muscle is sore. You're going to lift your body up slightly, and you can roll on it. So I can already feel that area is a little bit tight for me. Okay, so once you get into that spot that you really feel it, you can kind of move your leg in and out to get different muscle fibers, or forward and back, again to get different muscle fibers, or even more side to side. If you want to make it even more, you can put more weight on it. So if you just take a little bit weight off your shoulders, you're getting more weight in the area. You find that trigger point and you just hold it. You can hold it here for 30 seconds to a minute and just really let it go. Now, if it's painful, we don't want to do this too much. We just want to do it where it's uncomfortable, not super pain. The other thing you can do, which is going to be harder for me, is you can cross your leg up, and it opens up that muscle even more. So I can feel it even more when I cross my leg like that. And again, you can roll along that area for anywhere from 30 seconds to a minute in each little spot, just to really let that musculature calm down. So this again is a therapy ball, yoga tune-up ball, but feel free to use a tennis ball or baseball. Baseball, if you do use it, because it's so hard, make sure to put like a couple socks around it so it calms it down. It might be too hard for you, but a lacrosse ball or a tennis ball might be a better option. So I hope that helps everyone, and just make sure to stretch as much as you can. Whatever your side is, that's the symptomatic side, make sure to do that side a little bit more, but even still do the opposite side, because there can still be issues happening on that opposite side that maybe just haven't presented themselves to you yet. All right, everybody, I hope you have a great day, and we'll talk soon. Bye-bye.